We're at the beginning of modernizing the ways in which we measure outcomes. For example, we're seeing the emergence of patient reported outcomes in hospitals. And these patient reported outcomes are different from traditional outcome measures in that we look over a much longer time horizon at how a patient recovers from a procedure. So, for example, if you have a hip or a knee replacement, we'll look not just at whether you were readmitted within 30 days of that procedure, but we'll look at whether you're recovering function, whether you're returning to some of the activities that you enjoy every day. And it's that transition that really helps to bring the patient voice to outcome measures in a new way. Advancing health equity is another important way in which we're modernizing our approach to measurement. Advancing health equity really is at the heart of how hospitals and health systems are caring for their patients and communities. Hospitals are working internally with their outcomes data to understand where disparities in care may exist. For example, they may look at the languages that their patients speak and understand whether there are differences in outcomes by the language spoken. They'll also work externally with community based organizations and other key stakeholders. We know that health outcomes are driven not just by what happens inside the four walls of hospitals, but also by the supportive resources that are available in the community to assist patients when they leave the hospital. And so they work with these organizations to enhance their resources, to coordinate efforts, and to really make sure that we are meeting patients where they are as they recover from the care they receive. For example, a hospital or a health system could partner with a local food bank to ensure that a patient that just underwent a surgical procedure has the right kind of nutritious foods to assist in their recovery.
So, one strategy that health care organizations can do is to really start collecting insights and metrics across the continuum. Most organizations already have a really in depth understanding of inpatient quality and inpatient operational efficiency. However, most organizations really don't understand operational efficiencies on the ambulatory side, hospital outpatients, ambulatory surgical centers, or in the transitions of care. And so, one question I would ask yourselves is, do you really understand how patients access your system and receive care in your system? The other thing that I would say is organizations really need to leverage their EMR. You've all spent millions of dollars on your EMRs, and they all have tools within their workflows that leverage technologies such as natural language processing, machine learning, in order for you to leverage the right information at the right place at the right time and really help solidify clinicians making the right decisions to drive optimal outcomes for their patients, not only in quality, but also in cost. There are a lot of initiatives that you can run within your organization right now to understand cost and quality. For example, how many of your low back pain patients that come into your emergency departments get multiple radiology scans? Looking at small problems with defined patient populations, it can open up a collaboration across your organization to get providers from multiple specialties involved and solving this problem in a sustainable way. And then finally, in the industry, there's a huge appetite for partnering with your payers. Payers are really looking for providers to come forward and tell them what metrics are important, how they can drive some cost and quality initiatives. So go ahead and partner with your payers on downside risk or upside risk. They're really looking for that. And most organizations have the tools and the knowledge and the metrics and methodologies within their clinical and operational realm to be able to define those things and achieve some success financially on the back end.
We live in an interesting time where we have more data than ever before. Electronic health data, claims, patient reported outcomes, a lot of wearables, patient-reported monitoring data. But at the same time, what I hear from frontline caregivers and physicians is that we don't always have the right data at the right time. And so it's really important that data is actionable. It's often said that your zip code is more important than your genetic code. And it is so true when we think about social determinants of health. And so it really does impact the health outcomes of our patients and our community. So for example, when we take care of our diabetic patients, we realize that many of them have challenges getting their medicines, getting them at an affordable price, or just getting them, period. So we've connected them to our patient assistance program and working with other community resources to make sure they get the meds that they need. That has then allowed them to take better control of their diabetes. And as a result, we've seen improvements in A1C control and other diabetic measures over the last year because of the efforts we're doing to address their social determinants of health. When we think about how to make data actionable, we really need to think about two different levels, the patient level and the population level. So first and foremost, when we see a patient or they're in front of us, we want to make sure that we have the information readily available that allows us to take action right then and there. At the same time, we have to step back and look at the panel of patients that we care for and look to see if there's any variations in care, any disparities, or any areas where we can additionally focus. And so having that both views is really important, looking at the patient level, but also looking at your practice and population level.